The hands won't stop shaking. 12 years on the job and the hands still won't stop shaking when it matters. Blood on the asphalt, glass everywhere. That particular smell of torn metal and leaking gasoline that means someone's day went spectacularly to shit. Two someone's, actually. Maybe three if you want to get technical about it. Patient A is making sounds. Not words, just sounds. The kind that means something important inside decided it didn't want to be inside anymore. Internal bleeding, obviously. Severe. The skin's already got that waxy quality, like a department store mannequin. 80% mortality without immediate intervention. Those aren't great odds. Those are playing Russian roulette with 5 chambers loaded odds. Patient B is pregnant. Very pregnant. The kind of pregnant where you wonder if she swallowed a basketball. She's conscious, alert, talking even. Always a good sign, except her blood pressure's dropping and there's this look in her eyes. That look. The one that says she knows. 30% chance both die if transport's delayed. 30%. That's almost reasonable. That's maybe we'll all get through this odds. Except here's the fun part. There's one ambulance. One. The other unit's 15 minutes out, which in medical emergency time might as well be 15 years. 15 minutes is the difference between walked away with a story and closed casket. So, math time. 1 life at 80% versus 2 lives at 30%. Simple, right? Except nothing's ever simple when you're standing in gasoline-scented air watching 2 people bleed in different directions. The logical choice is patient A. Save the sure thing. The trolley problem solved with brutal efficiency. Take the 80%, walk away with 1 living person, sleep fine at night because you played the odds correctly. Except the logical part of the brain isn't the part doing the talking right now. Right now, it's the part that keeps whispering, 2 lives, potentially 2 lives. But that potentially is doing a lot of heavy lifting, isn't it? Potentially, maybe, might. The language of cowards and optimists, and there's not much difference between the two at 3 in the morning on a highway. Patient A's sounds are getting quieter. That's bad. Quiet is bad. Screaming means you're alive enough to be pissed about it. Quiet means the body's starting to prioritize, shutting down non-essential systems like a computer going into power-saving mode before it dies. The pregnant woman's saying something. Please. Of course it's please. It's always please. Like manners matter when your organs are failing. Like politeness is some kind of magic spell that'll make the universe give a damn. Here's a fun fact nobody tells you in training. Decisions like this don't feel like decisions. They feel like falling. You don't choose. You just suddenly discover yourself already moving in a direction and your brain scrambles to justify it afterwards. Free will's a hell of a drug. The hands are still shaking. The legs are moving toward patient A. Apparently some deep lizard part of the brain already did the math, factored in the certainty coefficient, calculated the expected value of life-saving intervention, and said, that one. The pregnancy doesn't get bonus points. 2 uncertain lives don't beat 1 certain death. That's the rule, that's the protocol, that's the answer you give at the inquiry board when they ask why you made the choice you made. Except now the pregnant woman's grabbing at clothes, at anything, her hand finding fabric and squeezing. My baby, she's saying. Not me, my baby. Because of course. Because the universe has a sick sense of humor and decided this needed 1 more layer of awful. Help's coming, the voice says. The paramedic's voice. Detached. Professional. The voice that said this lie 1,000 times before. 15 minutes. Just hold on. 15 minutes. An eternity. A nothing. Schrodinger's timeline where everything and nothing happens.
Patient A's loaded, strapped in. The ambulance doors are closing and that's it. Decision made. Die cast. All the other cliches that mean too late to change your mind now. Through the window, the pregnant woman still visible. Another paramedic from the fire truck trying to stabilize her, talking into a radio with that special urgency that means hurry the fuck up. The engine starts. The siren wails. The whole mechanical orchestra of emergency medicine doing its thing. Patient A's still making sounds. Quieter now, but still there. Still alive. That 80% slowly ticking down with every passing second, racing against time and bleeding, and all the things that can go wrong in a human body. Somewhere behind, 15 minutes is counting down for someone else. For two someone else's, technically. 30%. Not great, not terrible, better than 80, worse than everything. The hands are still shaking on the steering wheel. The radio's crackling with traffic. Someone's asking for an ETA, someone else is calling out vitals. The world keeps spinning because the world doesn't stop for moral dilemmas. Here's the thing about triage they don't tell you. You never know if you made the right choice until after, and sometimes not even then. Sometimes the person you saved dies anyway. Sometimes the person you left lives. Sometimes the universe just shrugs and says, hey, everything's arbitrary, nothing matters, thanks for playing. Patient A's blood pressure is stabilizing. The IV's flowing, the monitors are beeping in that steady rhythm that means not dead yet. 80%. The odds are improving with every mile, every minute, every medical intervention that couldn't happen on a highway. 15 minutes. The other ambulance should be there by now. Should be. Unless there's traffic, unless there's complications, unless the universe decided it wasn't done being cruel today. The hospital's getting closer. The lights are visible. Almost there. Almost safe. Almost. And somewhere in the back of the brain, that dark little voice asks the question that'll be asked every night for the next however long, what about the baby? But the hands keep driving. The siren keeps wailing. The ambulance keeps moving forward because that's what ambulances do. They move forward. They don't stop. They don't second guess. They certainly don't think about the mathematics of dying or the philosophy of choice or how many lives equal one life. They just drive. The hospital doors are opening. Staff is rushing out. Patient A is being transferred, rushed inside, still alive, still making sounds. 80%. The odds were played, the math was done. And in 15 minutes, actually 17 because traffic, another ambulance pulls in. 2 patients, both alive, both stable. Sometimes 30% is enough. Sometimes the universe lets you have both. Sometimes you get to be wrong in the best possible way. But the hands? The hands keep shaking anyway.